Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Eye cancer. Introduction. Cancer of the eye is uncommon. It can affect the outer and inner parts of the eye. The two most common types of eye cancer include intraocular melanoma, retinoblastoma. These cancers affect the inside of the eyeball. Cancer that starts inside of the eyeball is called intraocular cancer. Cancer that starts in the cells of the retina is called retinoblastoma. This program focuses on two types of eye cancer. One is intraocular melanoma, the other is retinoblastoma. The program explains these two types of eye cancer as well as treatment options. The eye. It is important to recognize the parts of the eye to help you better understand eye cancer. This section reviews the anatomy of the eye. The cornea is the transparent covering on the front of the eye. It is part of the outer layer of the eye. Light hits the cornea of the eye first. The outer layer of the eye also includes the sclera. The sclera is the white of the eye. The middle part of the eye includes the iris, ciliary body. The iris is the colored part of the eye. It controls the amount of light that enters the eye. In the center of the iris is an opening called the pupil. Light travels from the cornea to the back part of the eye through the pupil. As light passes through the pupil, it enters a clear lens that focuses the light onto the back of the eye. The lens acts like the lens of a camera. The ciliary body is a ring of tissue with muscle fibers that change the size of the pupil and shape of the lens. It is behind the iris. After passing through the lens, focused light continues through a clear gel. This gel is called vitreous. The light moves to the back of the eye where the retina is located. The retina changes light into electric signals. The signals are sent through the optic nerve to the brain. The brain translates the signals into the images we see. The middle part of the retina is called the macula. The macula allows us to see things clearly. The rest of the retina is called the periphery. It helps us see things on either side of us. This type of vision is called peripheral vision or side vision. The choroid is the layer of blood vessels that bring oxygen and nutrients to the eye. It is located in the back of the eye by the retina. Eye cancer. The body is made up of very small cells. Normal cells in the body grow and die in a controlled way. Sometimes cells keep dividing and growing abnormally. The growth is called a tumor. If the tumor does not invade nearby tissues and body parts, it is a benign tumor. It is also called a non-cancerous growth. Benign tumors are usually not life-threatening. If the tumor invades nearby tissues and body parts, it is called cancer. It is also called a malignant tumor. Cancer cells spread to different parts of the body through blood vessels and lymph channels. Lymph is a clear fluid produced by the body. It drains waste from cells. It travels through special vessels and bean-shaped structures called lymph nodes. Cancer that spreads from one organ to other body parts is known as metastatic cancer. For example, a cancerous tumor in the eye may grow. It can spread to nearby tissues over time. Cancers in the body are given names. The name depends on where the cancer started. Cancer that begins in the eye will always be called eye cancer, even if it is spread to other places in the body. If the cancer starts inside the eyeball, it is called intraocular cancer. The most common type in adults is intraocular melanoma. It starts in the middle layer of the eye. The most common eye cancer in children is retinoblastoma. It starts in the cells of the retina. It rarely spreads from the eye to nearby tissues or other parts of the body. Sponsored by the Patient Education Institute.
www.patient-education.com. Over 5,000 videos and interactive tutorials.
Causes and risk factors. It is usually impossible to specify the cause of cancer in an individual, but we do know what causes cancer in general. Healthcare providers know of factors that can increase the chances of getting cancer. These are known as risk factors. Repeated exposure to natural or artificial sunlight is a risk factor for eye cancer. An example of artificial sunlight is light from a tanning bed. Another risk factor for eye cancer is having a fair complexion. This can mean having fair skin that freckles and burns easily, does not tan or tans poorly, blue or green or other light-colored eyes. People who have white skin are at a higher risk. So are people who are 55 years of age or older. Retinoblastoma may be caused by a gene change passed from parent to child. This is called hereditary retinoblastoma. It usually happens at a younger age than other types of eye cancer. Having hereditary retinoblastoma puts a child at risk of having other types of cancer. Regular exams are important to check for these. It is important to find the cancer early if it happens. Not everybody who has risk factors for eye cancer gets it. Some people who have no risk factors for eye cancer can still get the cancer. Symptoms. Symptoms of eye cancer differ depending on where the cancer starts. Intraocular melanoma starts in the middle layer of the eye. Retinoblastoma starts in the cells of the retina. Intraocular melanoma may not cause any early symptoms. Sometimes it can be found during a regular eye exam. Common symptoms are a change in the shape of the pupil, a change in vision, a dark spot on the iris, blurred vision. The tumor may cause the retina to separate from the eye. When melanoma affects the ciliary body, glaucoma can develop. Glaucoma can damage the optic nerve. This can lead to vision loss or blindness. Often glaucoma does not cause any symptoms. If you have symptoms, they may include blurred vision, eye pain, eye redness, nausea. Retinoblastoma causes different symptoms, including eyes that appear to be looking in different directions, pain or redness in the eye, the pupil of the eye appearing white instead of red when light shines into it. This may be seen in flash photographs. Your symptoms may not be caused by eye cancer. Make sure to see a healthcare provider to find out what is causing your symptoms. Diagnosis. If you have the symptoms of eye cancer, your healthcare provider will try to find out if eye cancer is the cause. There may be another cause. Your healthcare provider will ask about your family's medical history. You will also be asked about your symptoms. A physical exam will be done. Other tests may be done as well. An eye exam with a dilated or enlarged pupil can show the back of the eye. A healthcare provider will dilate the pupils using medicated eye drops. The inside of the eye is examined using a device that makes a narrow beam of light. Pictures may be taken to record changes over time. Another test that may be done is an indirect ophthalmoscopy. This exam looks at the back of the eye. It uses a small magnifying lens and a light. An ultrasound can also make a picture of the inside of the eye using high-energy sound waves. First, eye drops are used to numb the eye. Then a small probe that sends and receives sound waves is placed on the surface of the eye. Other imaging tests may also be done, including a CT scan or MRI. These tests can make more detailed pictures. A fluorescein angiography can also diagnose eye cancer. It looks at blood vessels and the flow of blood in the eye. A dye called fluorescein is injected into a blood vessel in the arm. The dye travels through blood vessels in the eye. A special camera looks for any blockages or leaks. Other tests may also be done to look at the iris or cornea. The lens and ciliary body may also be examined. Often a biopsy is not needed to diagnose eye cancer. Staging. If you have eye cancer, your healthcare provider will determine the stage. Staging is an attempt to find out how large the cancer has grown. It also looks to see if the cancer has spread to other parts of the body. The stages of eye cancer are different for each type. Intraocular melanoma is staged by the size of the tumor. The stages of intraocular melanoma are small, medium, large, diffuse. The stages of retinoblastoma describe where the cancer is found in the body. The stages are intraocular retinoblastoma, when cancer is only found in the eye. Extraocular retinoblastoma, when cancer has spread beyond the eye. It may spread to tissues around the eye. It may also spread to other parts of the body, such as the brain or spinal cord. It may also spread to the lymph nodes or bone marrow. Many of the same tests used to diagnose eye cancer are used to stage it. Other tests may be done to determine the stage of the cancer. A gonioscopy looks at the front part of the eye between the cornea and iris. A special instrument is used. It checks for blockages in the area where fluid drains out of the eye. A special type of ultrasound can be used. It is called an ultrasound biomicroscopy. It finds and measures small tumors in the eye. Blood tests may be done to check for certain substances that indicate disease in the body. For example, the blood can be tested to see how well the liver is working. If the liver is not working well, cancer may have spread to the liver. A chest X-ray may also be used to stage eye cancer. It can show if cancer has spread to organs or structures in the chest. A spinal tap can check for cancer cells in the fluid around the brain and spinal cord. This fluid is called cerebrospinal fluid. It is also called CSF. A spinal tap is done by inserting a needle into the spinal column and removing a small amount of fluid. To see if eye cancer has spread to the bone marrow, a bone marrow aspiration and biopsy can be done. For this test, a hollow needle is inserted into a large bone. Often it is the hip. A sample of bone marrow, blood, and a piece of bone are removed and tested. Treatment and supportive care. The type of treatment used depends on many factors. It depends on the health of the patient, size and location of the tumor, stage of the disease. Treatment for eye cancer may include surgery, radiation therapy, chemotherapy, photocoagulation, cryotherapy, thermotherapy. Often some combination of these treatments is used. Radiation therapy uses high-energy rays to kill cancer cells. This stops them from growing and spreading. The radiation that treats the cells comes from a machine. The machine aims the rays at a specific area of the body. Radiation may also be given internally. Internal radiation therapy uses a radioactive substance sealed in objects like needles, wires, or catheters. These are then placed in or near the cancer. There are also other types of radiation therapy that may be used to treat eye cancer. Talk to your healthcare provider to learn more about these types. Chemotherapy is the use of drugs to kill cancer cells. Chemotherapy is usually given in the bloodstream through an IV, or it is taken by mouth. The drugs may also be placed directly into the fluid in the spine. Photocoagulation uses laser light to destroy blood vessels that supply nutrients to the tumor. This causes tumor cells to die. It may be used to treat small tumors. Cryotherapy can also treat eye cancer. It uses a special instrument to freeze and destroy cancer tissue. It is sometimes called cryosurgery. Thermotherapy uses heat to destroy cancer cells. A laser beam delivers the heat. The beam may be aimed through a dilated pupil. It can also be aimed at the outside of the eyeball. Surgery may be done to treat retinoblastoma. The surgery removes the eye and part of the optic nerve. This is done if the tumor is large. The cancer is likely to spread to other parts of the body. There is little or no chance that vision can be saved. There may be clinical trials available for people with eye cancer. Clinical trials test new medical approaches and treatments. Eye cancer and its treatment can lead to other health problems. It is important to have supportive care before, during and after cancer treatment. Supportive care is treatment to control symptoms, relieve the side effects of therapy, help you cope with your emotions. Supportive care also deals with the pain associated with cancer and its treatments. Your healthcare provider can suggest ways to reduce pain. You may also be sent to a pain control specialist.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. Cancer of the eye is uncommon. It can affect the outer part of the eye, such as the eyelid. It can also start inside the eyeball. This is called intraocular cancer. The most common intraocular cancer in adults is melanoma. The most common eye cancer in children is retinoblastoma. It starts in the cells of the retina. Treatment for eye cancer may include surgery, radiation therapy, chemotherapy, photocoagulation, cryotherapy, thermotherapy. Often, some combination of these treatments is used. Eye cancer is most treatable in its early stages. Research already has led to advances that have helped people live longer. Researchers continue to find better ways to care for people with eye cancer. Thank you for using Explain.